Brighten up your day, go home with family
Does your child snore? Does this sound abnormal? Is it normal? Our next guest is the director of pediatric ear, nose, and throat at UCLA. She's the author of this book called Take a Deep Breath and has the real deal on what goes on when your child is sleeping. Welcome, Dr. Nina Shapiro.
Thank you. Thank you.
Is it normal that my child is snoring? Kenneth talked about at the beginning of his show, his child snores, his daughter.
You know, all kids do snore at some point, and it is normal to some degree. If you hear a little noise from the room, it's okay. But if it gets to any extreme where you are hearing them so loudly from the next room, where it's not just snoring, but you hear these gasps and pauses and this really funny sounding breathing, then that is not normal.
Well, don't you have to differentiate between the fact if the child has a cold, or because they do snore when they have a cold because their noses get all blocked up, and whether or not this is something that could be a serious problem?
Exactly.
How do you tell the difference?
And sometimes it's hard because kids do snore when they have colds. And if your child normally doesn't snore, and then for the week or so that they have a cold, and kids, for instance, get about 10 colds a year, so they snore when they have colds, it's okay. But it's these kids that they're well, they're not sick, and they go to sleep, and all of a sudden it's, I mean, it's really this awful sound.
Yeah.
You know, they say it's like Darth Vader, or it's like your grandpa sleeping. That is not normal. So anything more than this little faint noise that you hear needs to be looked into.
What I think is alarming, see, the snoring wouldn't alarm me so much. This is what would alarm me. My wife would do this, is she would put her hand up to their nose when they were sleeping, and I'm like, what are you doing? And she'd say, oh, I'm checking to see if they're still breathing. Right. And you're like, what?
Yeah.
And that's one of the most common complaints I get for kids that I fix their snoring, because all of a sudden the parents can't hear their kid breathe. And you know what, that's normal. You shouldn't hear your kid breathe. You should see them sleeping comfortably, so you don't have to check with a little tissue. If they are alive, then they're okay, but you shouldn't have to hear them, and you shouldn't have to be putting your finger there, because you'll probably block their breathing a little bit.
Right.
What is sleep apnea?
Apnea.
What is that, and do babies have it, children have it?
Children can have it, adults can have it, babies can have it. And apnea means a period of time when you should be breathing and you're not. So little tiny babies have something called central apnea. It's a variant of normal, and it's pretty common, and it usually just goes away. And their brains are immature, so they're just lying there sleeping, and then all of a sudden they forget to breathe. Their brain just hasn't triggered them. So they stop breathing for what seems like an eternity. It's actually like 5 seconds. Well, then they start breathing again.
That would be alarming as a parent.
It's alarming, but it's normal and it goes away. But the sleep apnea that we commonly think about in kids and adults is really associated with loud snoring. So loud snoring to the degree where they're snoring, they're gasping, and then all of a sudden you hear silence. You're like, oh, this is good. And then all of a sudden you hear this big gasp for air 5 or 10 seconds later. That's what sleep apnea is.
Okay, so what causes this snoring? Well, what are some of the symptoms, what causes it, and what can we do as parents? What advice would you give to parents when they find this problem?
So sleep apnea is most commonly in kids caused by big tonsils and big adenoids. Occasionally it could be a cold, but big tonsils, big adenoids, these are those tissues that grow in the back of the throat. Sometimes they grow too big. So what I recommend is that after your child, and we're also excited once we sleep train our kids, we get them to sleep, we close the door, we have a night, at least 2-3 hours to ourselves. But that's the time when you really start to need to listen to your kid. And if you hear some snoring, then you need to look into it a little further. Check on them different times of night, see what their breathing pattern is, and then if you're concerned, have your pediatrician check it out.
So I have adult friends who they sleep with the apparatus, right? So what's the treatment for a child in that case if they're dealing with this?
So if you've ever met a kid, there's no way that they would tolerate one of those masks.
Not at all.
You can't put them on their face. You can't do that. So in kids, it's actually usually simpler because they usually have something blocking, whether it's allergies, a cold that goes away, or these big tonsils and big adenoids.
Does asthma?
Asthma usually is triggered from the big tonsils and adenoids. It can be dripping into their chest, but asthma won't necessarily do it. But if they have huge tonsils, huge adenoids, one or both, you can take them out. I know it sounds really simple. It is a surgery. It's an outpatient surgery usually. But that's usually a nice fix for this kind of problem.
What happens if you do nothing? you don't do anything?
So, if you don't do anything for sleep apnea in kids, a lot of parents are very concerned that, oh my God, my child is going to stop breathing in the middle of the night. That usually, I would say almost never would happen.
Yeah.
But what can happen is if they're not sleeping well at night, they're not going to be good during the day. You need a good 10 to 12 hours of sleep as a kid. And if that 10 to 12 hours is not a good 10 to 12 hours during the day, you and they will pay for it, and their teachers. So these are the kids who are not necessarily, we hear about adults falling asleep at the wheel, falling asleep at work because they're not getting good sleep. But kids, it's actually the opposite. They get something, they're tired and wired. So the kid that's running around the classroom.
But real quick, the damage that could be done if we are not aware of it and we as parents don't do it or don't do anything. What kind of damage happens to the child? Anything serious?
They can have, the mild things are, relatively mild would be behavior problems. They're not sitting still at school, they're not learning, they're not cooperating, they're not getting along with their friends, not getting along with their parents. So that's sort of, I wouldn't call that mild, but that's sort of not life-threatening. As far as more severe problems, kids with severe sleep apnea, they can have heart problems, lung problems, obesity, all the things that we see with adults as well.
Yeah.
Thank you.
Yeah.
And really, there's nothing we can do to prevent this other than just monitor it if they have to have their tonsils out.
What we can do is prevent the sequelae of the behavior problems and the heart and lung problems, but you can't make the tonsils not grow big. You can treat colds, you can treat allergies. If it's a physical problem, that needs to be treated.
Well, I just want to point out, when I was very young, I had my tonsils removed, and that goes a long way in explaining my lack of singing talent that I displayed earlier on the show today.
Or your good singing
Or you're
talent.
snoring.
or
I hear you in the dressing room snore when you take a nap in the afternoon. You snore.
I do snore.
No,
You hear that through the
I
other
do.
side?
I hear it.
Fantastic.
Well, maybe your tonsils grew back.
Nina, Dr. Shapiro, thank you so
Pleasure.
much for coming
It's a lot
by
of fun.
and enlightening us with that.
Thank you so much.
Up next, we are fixing up the kitchen with Tanya Meme.